Noury,
Uh,
how are you?
so I'm very sorry for the technical hinge that happened earlier this today morning. How are you?
I'm perfect, but we have a lot of technical issues.
Like your scrubs, by the way.
Thank you. I just worried because I'm at home right now, so to look cool.
Okay.
So, well, some people wrote me to repeat the live because of the technical failure that we have with the microphones and everything. I think that now it's normal. So, first, let me introduce you a little bit in Spanish. Okay. A ver, el doctor Noury Adel es de Egipto y es un reconocido maxilofacial. Tuve la oportunidad de conocerlo en 𝗀𝗵𝗄 París este junio y bueno, pues, lo invité a Valencia a realizar un pequeño taller en el cual nos acompañaron algunos compañeros y bueno, nos dio muchísimos tips fabulosos. Ready. That's the
Hi, Dr. Ahmed Shadi. So Ahmed is one of my friends. So he's just like waving his hands for me. So you were saying, first, I would like to thank you for inviting me again to this webinar. And for those of you who doesn't know, I had the pleasure of training some beautiful and talented doctors at Valencia at Dr. Gerardo's clinic. And so today we are supposed to talk about my three-point lips technique, right?
Yes, totally.
So perfect. So here's the thing. I do have here, this is a gift from you actually. This is the 𝘂𝗵𝗆. I stole it when we were in the training at your clinic. Or you gave it to me as a gift.
I know.
Okay, so I will remove the rubber cap. Here it is. And this is a SoftFil cannula. And what I love about this cannula in particular, this is a 30mm length. So it's very quite short. It's not like the ones that we used in your training, Gerardo. It's like, you know, here it is. Pretty short cannula.
Yes.
You got it? And you'd have a red dot to show you where your
where's the filler going? In what direction? Oh, we have problems again.
Do you hear me?
Mm-hmm.
Okay, perfect.
Yes, I hear you better.
So usually I start with drawing like 2 lines from the 𝗂𝗲 going down, 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 down till here. And I like to mark the midline and the tip of Cupid's bow. So the whole idea of this technique is like to invert the upper and lower lip and to give a little bit of a vermilion height through using 3 points of entry. One at the 𝗁𝗂 point at the left side, one at the right side, and one at the midline of the lower lip. So I would poke. Of course, I totally admire my friend, but I'm not gonna poke myself for you. So I'm just gonna like this. So I'm gonna poke here and here and here. Then after doing the entry points, I would enter with the cannula centrally and do a retrograde linear threading. Then before I go out, I would redirect my cannula to give a bolus here and again a retrograde, and the same to the other side. When I come from here, I would enter like this, bolus or a micro boluses like aliquot, whatever the nomenclature is. Yeah. I would go out, then redirect at this side. I never inject at the vermilion, so I don't touch this border, Gerardo.
Yeah.
And I never inject at the wet and dry border, so I don't even touch this border. Look, I look super funny with my big lips in front of the camera. So I just hope people get my point. And my plane of injection is always superficial. So I never, ever, ever like inject deep, always superficial. This is like the technique. So the thing is, I saw your beautiful case. You did it with a soft filler. But I always like to do this technique with a high G prime product. So this is 2 𝘂𝗷𝗆4. we're not like sponsoring 𝘂𝗃𝗃. We can inject palatal volume, Fillmed volume, Restylane lift. Yeah, any 𝗁𝗔 prime product. Of course, hyaluronic acid, we can use it. I like the technique. It gives a little bit of an eversion and a more plumpy lips for people who want to have a large lips. But at the same time, you can give a subtle approach with it. It's very important, like, to notice two things. Like the patient that I injected that you demonstrated this time, this morning. If you can notice, she had like a little small lumps here and here. This is where we placed the microboluses. So it's normal to be plumpy, and you should reassure the patient this is a normal thing. But remember that you should do a little bit of a molding.
Yep.
If she can come to the clinic, you can do it. If she cannot come, with a little bit of warm compression, she should put her finger here to avoid the spread of the filler and massage like this. You got it?
Got it. Perfect.
Exactly. The second thing regarding your patient also, that she told you that she feels that you want to plump her upper lip again. Oh, so as I told her when I was doing the training, and I will repeat it again, we do have a normal proportions that we should maintain. So usually when you open Instagram, you would find lots of pictures for Russian lips like this. Okay, this is not normal. We are supposed to have a lower upper lip that is 1/3 and the lower lip is 2/3. Of course, this is related to more to ethnic features, ethnicity. So in African and Asian, you would see a 1:1 proportions, but in Caucasians, this should be 1 and this 1.6. You got the idea?
Yeah, we got it. Yes, actually, it's what I explained also to her because of...
We used Fillmed volume, right?
Yes, Fillmed volume.
Okay. What are the other ranges for Fillmed? You told me Fillmed volume, universal.
It's volume, universal, and fine lines.
Okay. And what was the NCTF? We don't have it here. You told me skin booster?
Yes, it's like a skin booster. It's HA with with vitamins and amino acids. Those it's good for dark circles. And also neck. I use it a lot on the neck, and it suits very well to the patients.
We don't have it here in Egypt because we don't have Fillmed yet, but I guess it's maybe a little more of like the 𝗀𝗿𝗃𝗃.
Yes, totally, but it comes like 3 milliliters.
I do have actually another gift from you. This is from Fillmed Fine Lines.
Yes.
And I do still have this box. This is 𝗀𝗃𝗃. So we don't have it here in Egypt, but it's a biostimulator. It's a polycarbonate. So it's one way or another. I guess it's more like a hyperdiluted radius. So it like works on the same function.
They have different levels also.
Yeah, S, M, L, and XL.
Yeah, totally.
No, S, M, L, and E, like extra long, and short, yeah. XL, it's like we're in a global standard.
You read my mind. So I have also here some pictures if you want me to show them.
That's the word.
Okay, first of all, we need to...
If you have the video that Laura did, you can like show them a couple of shots, but don't show the full video because I'm supposed to present it at my lecture at the ICAD in Bangkok this November. I'm supposed to be seeing you, right?
Okay, yes, I'll be there for sure. In Bangkok. So I have a short video also of the after, just right after the procedure. So maybe I can show that result.
Sure.
Okay, wait a minute. I'll try to. First, the before.
Hey, doctor.
This. How can I turn my camera? Wait a minute.
I guess there's like a button to flip it.
Yes.
Yeah. Perfect.
This is the patient. Name.
Okay.
Gerardo. So I don't know. First, the proportions, okay, of the face. After.
So can you see, Gerardo?
Yes.
she have a very, very small lips, and it's very thin, very delicate. You cannot say that this is like an easy lips.
No.
Those lips, you want to go with something very soft. You want to build it up in like several stages and several sessions.
Yes, totally.
You can also feel how much there is like this area, the cheeks, the under eye, the nasolabial. She lost lots of support. So if you would like think in a pan-facial approach, you would like to start dealing with the mid-face, but we just used injected her lips for the training. But and I used the 𝗁𝗄𝗰 product, but if it was like if you are having another alternative, we would better start with the soft products. And you can see the asymmetry. Like this side is not like this side. You get it?
Yes, totally. Here.
Exactly. This is like thinner, and there's a little bit of a defect at the the peritomal area, like this area.
Yes, and
exactly.
Some people think that using 𝗁𝗄𝗰, they would get like super big lips, but it's not the case. Let me show you the after.
No.
It's
You cannot look. Yeah, so you know, Gerardo, lips are very delicate. You cannot overfill them, because if you did so, the filler eventually will escape and migrate and go to the skin border to form a mustache or a plateau in this area.
Yes,
it's very important, like, to go on stages. I like 𝗁𝗄𝗰 product, but again, if you remember, we placed a very minimal amount. Hi, Ahmed Shadi. ازيك يا أحمد؟ منورني.
Yes, it's perfect. Actually, it's just perfect. You know, with this 𝗁𝗄𝗰, it's well, the patient was fascinated with the results because it's super natural, and she didn't have a bruise at all. So that's important.
Yeah, but you see, Gerardo, could you please zoom in the after picture?
Sure. Wait a minute.
So look, she is this is pictures after 1 week, right?
Yes. Thank
you, Laura. Super nice, love it. We love you too. So the thing is, can you notice, like, at this area, at the tubercles?
Yeah.
It's a little bit lumpy, and this is normal. So we will have to instruct her, like, to compress this part and to mold this area, because the filler is still soft. It's still a fresh filler. She's just like, it's 1 week post-injection. So this is pretty normal. And it is super natural. Of course, the lower lip is bigger than the upper lip, but again, this is the normal proportions. By the way, Gerardo, this is not the end of her journey. No. We can add more to the upper lip.
Yes, actually, she want me to do the procedure, but
you are pretty good in doing the 3-point lips, so you can go for it.
Yeah.
Because as I told you, we cannot just simply like fill it in a one stage. You have to do it gradual. I guess if you like zoomed out your camera, people are gonna see the before and after better. Thank you, Dr. Ahmed. Thank you so much. Yeah. Dr. Syed. Hi, Dr. Syed 𝗀𝗃𝗿. So yeah, this is pretty cool. Wow.
Yeah, I love this because also
did you notice something, Gerardo? The barcodes, yeah, the static lines, the barcodes.
Yes, totally. The barcode, well, it's like a Photoshop thing, you know? It's like magical.
Marlene from SoftFil. Hi, Marlene. Hi, my friend. So actually, we are discussing this 3-point lips technique using the SoftFil cannula. So yeah. So this is a nice thing for a first session using fillers. We can add more, but I would recommend that you go on with a very, very soft product. You can play in this area, Gerardo.
Yes.
The peritomal lateral area. Exactly.
Yeah, totally. Do you want me to start the video?
Yeah, sure.
Just right after the procedure. Okay, let me wait a minute. I'll try to find it.
But like, don't play the whole video because I'm supposed like to present it.
No. It's just the after. It's just the after after procedure. Just this part because it's
wow.
Just the dynamic is super cool.
And did you notice something? We use the term myomodulation because if you remember, we placed filler at the nasolabial and
yes,
the 𝗏𝗏𝗏𝗏𝗏.
Yes. She noticed
So,
that also.
So we affected the orbicularis oris muscle action. If you can see, the barcodes almost vanished,
Yes,
and we didn't place filler here. Yeah.
Yes. Actually, yes, she noticed a lot. Look, let me return to this picture.
Do you have a picture for the patient that the doctors injected at the training?
Which one?
The one that Qiaoline and Jaime and David injected?
The 𝗀𝗵𝗿.
No. Yeah, and the other girl that you did the 3-point lips for her.
Oh yes. Oh no. Well, the revision is actually on Wednesday.
Okay.
Sorry.
But you have the 𝗀𝗵𝗁 patient, right?
Yes, I have it here.
Oh, could you demonstrate it?
Yes.
Okay.
Well, I'll skip a little bit, okay?
Okay.
Wait for me. Don't go.
By the way, I can see you. I cannot see the screen.
Okay, I know. But I need to get out of Instagram just a little bit, okay? Wait.
Sure.
I'll be frozen. Now I have it here.
I took lots of screenshots with your hilarious pose that you left.
Okay, perfect. So I have it here. Sorry for the delay.
That's fine.
I'm going to search here. And okay. Are you ready for this?
Yep.
Because it's amazing results here. Look.
Wow. This is like the before after picture.
Yeah, the before.
Yeah, so where's the after one?
It's pretty clear that it's a 𝗀𝗵𝗁.
Yeah.
So, and after the treatment,
wow,
it's totally different. And actually,
this is perfect.
She feels that
Look, may I say something?
Yes, sure.
Can you notice this area?
Yes.
You can give a 2-unit right here.
Yeah.
It will descend this part of the lip.
Yes, because it's well, it has more strength, right?
Exactly. So the thing is, in this patient, we injected toxin for the 𝗀𝗵𝗁, and as I said in the course, I like to choose my injection points depending on which muscle is hyperactive. We injected at 1 centimeter from the ala of the nose right here, and we gave another injection there, and we did a lip flip, by the way. If you could remember, we injected right at the vermilion border of the lips a couple of units.
Yes.
It was intradermal injections. And Gerardo, we placed filler at the 𝗀𝗶𝗆 foci and nasolabial, and we did it with a multi-layered technique. We placed fillers both superficial and profundo at the 𝗀𝗆 foci, Did I
Yes.
speak Spanish right?
Yes.
Wow. Oh, I'm starting to learn, huh? So, yeah, we place. So, profundo is deep and superficial is superficial. So, I did a multi-layer technique for the fussy hair here using the filler, deep and superficial, and I filled the line with the superficial linear threading, all using the SoftFil cannula and Fillmed filler. And as you can see, it does have a beautiful result. My recommendations, if she is bothered with this area that still lifts, we are gonna give 2 units right at this area here.
Yes.
So you would relax at this part of the orbicularis oris, and this part will descend. So
Actually,
it will be more symmetrical.
She's not worried at all. So I told her actually, and she said that it was fine. It was perfect for her. And in those cases, it's better done to do more.
Okay.
Hi, Anna.
Thank you, Doctor. Also, Dr. Manal Hussein is one of my best friends. She is working with me in my institute. شكرا جدا دكتورة منال. تسلمي لي. So what were you saying?
Yes, that she's perfect that way because she liked it, and she didn't want me to use a little bit more Botox. So I didn't do anything.
Do you have the pictures for 𝘁𝗂𝗋?
Well, the thing is that I will disappear again because I'm working with my phone and it's like lagging.
Okay.
But maybe I can do, if you want me, like a post with the before and afters of all the course, and I do the collaboration with you, and you'll have it on your Instagram also.
Sure. Yeah. So we injected her hands.
Oh yes. She's totally fine actually. She loved it, but she wants to see the result just 3 weeks more, for example.
Yes. So we injected radius. We used it in 2 formulas. We injected radius in its pure form to fill the hands. Then we did hyperdilute radius as a biostimulate for the skin. It was also a nice case.
Yes.
So, yep.
Well, I have some pictures actually. Sorry for that. It was my battery. I have the pictures of the radius here.
Hi, Dr. Sara.
Tienes las de antes, okay. I have the before and after of the hands if you want to see it.
Sure.
Laura,
I guess Laura did a beautiful video like how to do the injection with the cannula.
Right now, Laura is sending me the pictures. I have it here. Look.
Are you sure that your phone is connected properly to a charger? Because we don't want to ruin this webinar.
Yes, don't worry.
Okay, wow.
Okay,
but Gerardo, so yeah, this is perfect. So this is, how would you grade this hand according to Mer's scale? Like grade 4?
Probably yes. you can feel also the whole.
If 𝘁𝗂𝗋 is seeing our webinar, we love you, 𝘁𝗂𝗋, but this is for scientific knowledge.
She's here.
So, oh, okay. I didn't notice.
No,
so
I thought.
Okay.
She's not.
So the thing is, she does have a very visible veins and tendons, and usually people they may do a full face beautification procedure, but they will always forget their neck and their hands. You get it? So people would usually do not focus that much on doing neck treatment and hand treatment. So usually lots of clinicians would choose to go with the hyaluronic acid filler in the hands, but we always forget that the radius is FDA approved to be injected in the hands. So this is both hands. Can you start the video?
Oh, it's not the video, actually. It's
the pictures. Okay.
Pictures, but I have.
Do you have the after one?
Yes. Let me take it.
Okay.
Send the video, please. She's working a lot right now. So I have it here. The after.
Wow. So can you see? No visible veins, no visible tendons. So I injected 𝘁𝗂𝗋 when I was in Dr. Gerardo clinic. We did a radius Radius, it's a filler made of calcium hydroxyapatite. I injected 0.5 here, 0.5 here as a solid form, like the same product. Then I used the dilution with the saline and I placed it superficially to target the skin. So it's like I played with the same product in two different formulas to give two benefits, to fill the hand and to also biostimulate the skin of the hand to get a better skin texture. You are receiving green hearts, Dr. Gerardo.
Yes, yes. Actually, but but you told me that it's pretty new in Cairo, right? In Egypt.
Yes, so Radius have been recently launched in Cairo. So we do have it right now, but it was not always there. But you would have to bring it, like the company would bring it in a special order, but now it is there at the store for anyone who want to bring it from MERS, Egypt.
Oh, that's cool. Here
Thank you, Dr. Manal, for your beautiful comment. 𝗀𝗲𝗍𝗍. Okay, this is me doing the injection. So Dr. Manal, I have a question, Gerardo. She says, how long will it stay? So the thing is, if you are using Radius filler for the hand, it may last up to 1 or a year or 1.5 years. Actually, depend on the amount of syringes that you placed. We only place 1 syringe. You will probably need a touch-up after a couple of months. Yes. But Radius lasts pretty long, much time in the hand, unlike hyaluronic acid fillers, which may resorb quickly. But we have always to know that Radius is a semi-permanent material. Hyalase doesn't have any effect on Radius, so we must be extra cautious using Radius. Here I'm using a SoftFil 22G cannula. So the cannula is pushing the veins because you don't want to poke a vessel and inject intraluminal or you will have a basilar occlusion. So we were very delicate with her hands. I never had a hand massage before. Okay.
Yes,
so we injected. Yeah. So how we can, like the tendons disappeared. Do you get it?
Yes, totally. So it was such a perfect demonstration. Charlie, yeah. Super funny. So that's it.
Yep.
So Noury, thank you for everything. Really, we enjoyed a good time here in Valencia, and I really hope that you enjoyed the city, the patient, the doctors that came here. So thank you very much.
You are welcome, my friend, and thank you so much for inviting me to share what I have. And hopefully we will meet up this November, right?
Yes, November at the ICAT Congress.
Yes.
We'll let a couple of
bye-bye. Yes. Good night, my friend.
Bye-bye.
Send my best regards to Laura. Bye-bye.
Bye.